So before we actually start the conversation, I just want to talk about how difficult it was for us to find a policy to break down concerning women in Nigeria. I thought that it was very telling of our current situation in the country. Women make up how many percent? I think we're like 53% or 55% of Nigeria's population, and we don't have any dedicated policies that come to mind immediately when you're thinking of women in it doesn't even matter what space, whether development, health, whichever space you're thinking of. So yeah, just to start us off on that very, very morose note. Good afternoon, everyone. Well, I'm glad that International Women's Day is celebrated every year because it helps to bring attention to these issues that are very salient and very important. And we have amazing guests today who will help us make sense of these statistics and how the national gender policy is doing to address them.
Yeah, interestingly, and the theme for this year is focused on embracing equity.
But before we begin, can we get our guests to introduce themselves, please?
Very important.
We'll start with you.
Okay. I'm Patience Ogolo Dixon, advocacy for women with disability. I'm the founder, and then I'm also the executive director. I work with women and girls with disability.
Thank you so much for joining us today. And our second guest.
Oloma Umeje. I'm a program manager here at Nigeria Health Watch.
Okay. So let's start this way. From your experience, Oloma, what are the biggest factors preventing women from accessing opportunities and health services fairly?
Okay, so I'll break that into two parts. The first one, which is what limits women and girls from accessing opportunities generally, and then what limits them from accessing healthcare, mostly as it relates to maternal health, because Chibike had made reference to maternal health in the beginning. So for opportunities, for things that relate to economics, like I would say it's what tops the chart would be lack of empowerment. Women are not really empowered, especially in Nigeria, and this is what even came out in an NOI polls recently. And there's also poverty, there's lack of quality education, and then of course, gender norms, cultures that we are used to, and all of those even though we are embracing
equity,
yes, it's not quite there in Nigeria. So it still kind of limits us. And then when it comes to maternal care, there are three major things. They call it the 3 delays, but I'll just try to break it down. Like the first one is
Break it down.
The first one will be delay in making the decision to actually seek healthcare. So, and there are many things that can make people to not receive healthcare as I went due. Maybe they've even accepted, if I die, I die. There's also the part of they don't have the money to access care. There's also the part of they don't have the permission from their family or their spouses and all of that. There are many things, maybe they don't even understand why they need to go to the hospital. Then there's a second one, which is delay in getting there. And that's where infrastructure comes in. That's where bad roads comes in. No money for transportation and all of that. And then there's a third one, and they get to let's say they get to the health facility now, and there's no adequately trained people to attend to them, or an adequate facility that can help their needs at that point. So those are the things I would say in those two areas.
Interesting. So for you, Ms. Dixon, as a woman with disability and also advocate for women with disabilities, are there peculiar challenges or other issues that impact women accessing opportunities and healthcare different from some of the ones that are already outlined by Obama?
Oh, thank you very much. It's a peculiar situation when it comes to issues around women with disability or girls with disability, because we already have these barriers facing them, barriers to infrastructure, barrier to communication, barriers to financial access, a lot of barriers working against. So, and then coupled with some barriers around sexual reproductive health, is a big issue for women with disability. I just want us to imagine a woman who is deaf. She shared her experience around, okay, I am pregnant and I went for antenatal, but I sat down with so many other women that I didn't even know what was happening because I am deaf. There's no sign language interpreter. Nobody told me how to take care of myself during pregnancy, what to eat, the right food to eat. No talk of taking care of my baby when the baby is born. So I was just there sitting. I was looking at that like an outcast. Okay? The issue is that because the system is not accessible, because issues of persons with disability regarding their special needs are not factored into the system, it is very difficult. Instead, I think people or the public see the person with disability as the problem instead of seeing the system as the problem.
Yeah.
So, for example, again, I am going to the health facility and then Uloma is just climbing freely and I'm on a wheelchair. There is no ramp, there's nothing, there's no access for me. And then how will I cope? You see people coming out, okay, we help you up. And people just lift you up. It's a big issue as far as we are concerned because that is very dishumane, because I would actually want to access just the way she has done. So there will be side-by-side access, stairs and ramp. That would have been a very ideal society. So these are some of the issues that women with disability go through.
Interestingly, what you said about imagining the deaf person trying to access maternal health care, for me, it's actually not difficult to imagine because I have a deaf sister. So I always thought about it. I used to ask my mom, what was it like, that experience accessing care at the hospital, knowing that those facilities are not there. So it's really a big problem.
No, you're right. I have an aunt who is deaf, and I remember when she was pregnant, there was so many problems involved in trying to get her to understand what was going on, simply because even when she goes to the hospital, when she goes for antenatal and all of that, nobody's really taking into cognizance her own particular situation. So they would, just as you said, they would run through everything that they need to run through and have the class as normal. But then she'll come back and we're asking her what we'd do is we'd write down with her and we'd speak that way. So we would ask her, okay, so what happened? Did they teach you? And she's just like, she has no idea what happened throughout that period. So at the end of the day, it was almost like my parents and my parents' siblings were doing the antenatal for us. So she would go to the classes, come back, and then based on experience, my mom and my aunties would be telling her, okay, so this at this point in time, this is what you're supposed to be doing. These are the drugs you're supposed to be taking, that sort of thing. Very, very.
It's a sad situation.
It is disheartening.
You also need to also check, especially with the experiences of the women that we work with. Okay, they say we prefer to stay at home and do the delivery and everything at home using the traditional bed attendants because they understand us. We live with them, so they understand our situation, they know. And they don't discriminate again. So that is a huge issue within the system as well.
Yes.
Yeah.
So they just prefer to stay at home, which is very, very dangerous, so to speak,
Yeah.
to some of them, because you can't really. There are some issues that may not be able. You may
can't
not
break
be able
down.
to correct at
That's
home
true.
or in the community.
That's very true. Now, the National Gender Policy 2021 to 2026 represents a set of minimum standards expected of the Nigerian government to meet its mandates for gender equality, good governance, accountability, and being socially responsive to the needs of its vulnerable groups, like we've just highlighted.
Just hold it there first. You asked me before. I will also ask you to. Yes, yeah. So it's my turn. So what it's when you say equality now? So just help break that down, because sometimes, like we said earlier, it's usually confused equity and equality.
Well, just like I said earlier, so equality is essentially being treated the same. So everyone gets treated the same. Everybody gets an orange, everybody gets a banana, everybody gets peanut butter, regardless of whether or not you are allergic or you are not allergic. Equity, on the other hand, means that everyone gets treated fairly. So everyone's needs are met where they are. So wherever it is that you are having problems or you're struggling, there are systems in place to ensure that you are still able to access a level playing field for you and other people involved. So you're getting treated fairly, but not necessarily the same way as everybody else.
Just like we've been saying, so women are accessing healthcare, but you take into account their different needs.
Yeah.
There are women who are blind, there are women who are deaf, there are women who who can't walk. So they all need healthcare, but what specific need? Okay, yeah. You have my blessings to continue now. You've broken it down.
Okay, so the policy sets out a minimum standard of what government should do. So, for example, in gender and employment, that's the labor participation of women and people with disabilities. What does this really mean, Ms. Dixon?
For people with disability, the truth is that we are still far from where we're supposed to be. But the good thing is that we are not really, we are in a particular level, and that level is, we are not where we were before. That is just what it means. Awareness is everywhere. People are becoming aware, and that is a good one. But people are not actually getting it the way it should. For example, you just talked about equality. So when it comes to equality, is my needs actually factored in? Is my needs actually prioritized when it comes to design? When it comes to planning? Okay, so if they are not thought of, and they are just, you plan for others, and then you plan for persons with disability as those that need care, those that need help, those that people have this kind of mindset that they are abnormal. So you begin to actually speak in policies, because the policy is actually designed by human beings who live in the community and who have that mindset already, that these are people who are not complete, who are abnormal. So they bring that into the system. And so that is why you see that policies exclude persons with disability and their special needs. So for the National Gender Policy, I am so glad that I was part of those that reviewed it last year. The first one wasn't inclusive at all, okay? But this second one, we tried, because I remember the women that were present, many of us, we really, about 40%, 50% of us argued why women with disability should be included. Because women have to actually begin to together advocate for women,
each other, yes.
so that we don't leave some of us, some women behind. So it's not really too inclusive, but it's a lot better than what we had before. So we are actually looking for a time or a period whereby women with disability would truly be known as women. Okay, there's a saying that says women with disability are also women too. Okay, women with disability, people will know them. Oh, you are good enough for marriage. You are good enough to have children. You are good enough to have your own decision. Okay, but right now, it's still not there. So that is where we are.
Interesting. Thanks for sharing that. Hopefully we'll get there someday. And I mean, that's why we're doing this. But when it comes to human development, which is, of course, another key part of the policy, it had some recommendations around maternal and child health, gender and health systems. Can you break this down, what this really means, Oloma?
Yeah, there are a number of things in the policy, a lot actually.
Yeah.
Before I heard her own angle, I would say it was very comprehensive in terms of putting into consideration every aspect of human development for women in Nigeria. But then coming from her angle now, so especially with all the parts that has to do with health, there's a section in the policy that spoke to gender and disability and all of that. But then when it comes to the part that spoke to maternal health, there was little or no mentions at all for women living with disabilities. And this is for maternal health, child health, all the way down to even reproductive health, women living with HIV and AIDS, all those things. It didn't exactly come out that from an angle of people that are living with disabilities. But away from that, for other aspects, and I'd like to borrow her word, for normal people, in quotes, normal people in quotes, right? It was very comprehensive in putting into consideration things that need to be put in place to ensure that women and girls across Nigeria have access to basic health needs. It even goes down to the government raising awareness, goes down to involving for childhood. You mentioned diphtheria and all of that, childhood immunization, and including community-based interventions to ensure all of those are done. It includes, sorry, I'll take that back. It took into consideration a number of things, very, very comprehensive for normal people. But then for abnormal people, again, in quotes, it completely excludes all of those. For it maybe just went in between the line, or they removed it when they're editing or something, but it wasn't there.
Interesting.
Yeah. That's very interesting.
Awesome. Thanks for sharing those interesting insights. And of course, there are so much areas that we can do better. But just to take a step back, because part of the work we do, we also, while we put out the problems, demand for change and all, we're also very conscious about looking at the other side of the story. So are there areas that are working? So this goes to you and Oloma. In both of your experiences, and particularly on this policy, the national gender policy, are there areas that are working, no matter how little, in addressing some of this? Just briefly, because if they are working, it is an opportunity to sort of, amplify to say, oh, let's keep doing better in this way, or learn from this to, do better in the other ways. What are your thoughts on that?
Okay, so like I said, the areas where the strategies or the approaches that the policy highlighted for improving access to maternal health in the policy, Nigeria is doing great in achieving it. Okay. Like the government raising awareness around ensuring safe family planning and all of those. Nigeria kind of funds the procurement of family planning commodities, and through diverse agencies, they also raise awareness for all of those. Then there's the one for amplifying child care immunization. That's been And I think at some point, Nigeria was also declared polio-free and all of that. So if it's for immunization, we're doing great. And recently, there was also, I think, is it called PV? Periodic intensification of routine immunization.
Okay.
That too has been implemented in Nigeria, and along with supplementary vaccinations and all of that, there are a lot of things going on that are working in terms of the strategy.
Okay.
And then I think there's also design of other programs that are targeted to maternal and child health that are being implemented, like the SHOP and recently EMSS and all of those. That there are many things, all the 8 things that they've highlighted in the policy, they are doing great at it. The only one that I would say we need to do a lot more in is including people that are created in a peculiar way, so that they receive the care that a normal person, and I'm careful to say, would receive.
Thanks. How about you, Ms. Dixon? Are there areas that are working, or we need to push for better implementation of the policy?
I think the mere fact that we have a better or more inclusive national gender policy is something that is working for women to come together and say, okay, we want to actually push and make sure that women with disability are part of the policy. It shows that people are becoming aware, and then their sisters have to support sisters. So I think that is one thing that is working, but we still need to do more in that area. We need to make the policy more inclusive because, like she said, there's still some gray areas that is not specific to women with disability. So we need to work around that. Then I think there's more engagement now.
Okay.
People, a lot of sectors are engaging with organizations of persons with disability because they feel that without them we don't know what to do. So for us to know what to do, how to actually amplify issues around persons with disability, we need to work with them. So, and that is very key. That is germane, because he who wears the shoes knows where he pinches. So there's a lot of engagement going on right now. So more engagement, unlike before, that doesn't exist.
That's
and when
true.
they engage with persons with disability, it shows more interest. It also shows that things can actually change. And then the last one I also want to talk about is there's lots of awareness everywhere. Okay, people are more aware, and I'm so glad for the SDGs that really brought out inclusion.
Yes.
Okay, SDG brought out inclusion. In fact, SDG is inclusion. So across all the 17 goals, we always say, okay, persons with disabilities enshrined in it. So it's so great that this sensitization awareness is everywhere. But what is still lacking is how are we able to actually meet our target group? So what approaches are we taking? So if we are going to the community right now and we want to meet with community around their health, and then maybe meet the community of persons with disability, how do you get those sensitization tools or whatever you have? How do they understand it? So those are some of the things that we need to work on, so that at the end of the day, we'll have a more inclusive society, that we are not leaving some community behind.
I think it's very interesting what you've just said. So I was thinking the other day that a few years ago, you would be watching something on TV and you would not see a sign language interpreter in that little box on the bottom.
Yeah.
Impossible. We had we had a, what's it called? Like a symposium a few years ago. And I kept thinking to myself, what if we had people who could only like read lips, or people who can't hear?
Yeah.
How are they getting the message that we're trying to pass across? And in the time since then, I've noticed that more organizations now have sign language interpreters. They have people to cater to people with specific disabilities. I think it's very interesting.
Yeah.
Just on a lighter note, there was the Super Bowl in America where Rihanna performed at the Apple Music halftime show. Her interpreter was singing and rapping along. Honestly, it blew my mind, and it just shows how much this having these people actually opens up access to others. Do you understand? It's incredible. It's very incredible. I'm very, very happy that we're having this conversation today. So yes, there's a lot that we can talk about when it comes to women and gender and the equal and fair access to opportunities and services. But I think for now, we're going to stop this conversation here. But we would like to continue the conversation via our social media channels. So we'd like to hear everybody's thoughts. What are your thoughts as a woman? What are your experiences accessing opportunities and services, especially healthcare services? As a person with disability, what has been your experience so far? Please share with us on our social media handles.
Yeah, I totally agree with you. There's too many parts of the conversation. We didn't even go into the part about he for she, getting men to support women and girls in their lives and in their communities. Yeah,
that's right. It's okay. It's all right. We move.
Yeah.
But before we close, as is our custom, who is doing amazing work in this area that we can shout out?
Well, there's so many of them. Difficult to name one, and but today is Women's Day, so I'll let you do the honors. Who do you want to shout out to us today? Just to say, well done. We see you. Keep up the great work.
So shout out to UN Women, the Ministry of Women Affairs in Nigeria. I think that they are doing well. What of local NGOs? Who do you think?
I can't remember the name specifically, but there's this NGO I heard about. They help people with disability navigate airports.
Ooh.
Yeah, they don't have the funding to be everywhere for now, but I think they're doing some. I've just came across them somewhere. I can't remember their name. Forgive me.
That's
Hopefully we tag them when we put out this. Yeah,
okay. Fingers crossed. There's this app called Be My Eyes. It's an application. So you join up, and then people who cannot see, have difficulty seeing, they can call you and say, oh, please, I'm having difficulty reading this. It can be anything. It can be their phone bill. It can be a letter from their friends or something, or an email that they cannot read because they are blind. They would call you and you would be able to help them. And it's an app. In Nigeria, I think I've helped about 26 people so far. So nice. Shout outs to me. And I know that there are a bunch of other people as well who are using this app and helping people with disability in this way.
They are all embracing equity.
Yes, please.
As the theme for this year says.
For women, yes. Embrace equity. Thanks and God bless.
Yeah. Okay, thanks Asari, and thank you so much, Oluoma, for taking our time to be part of this episode, and thank you so much, Ms. Dixon, and for being part of this episode. Until next time, I am Chibike Alaboso.
I am Asari Ndem.
Patience Ogolo Dixon.
Oloma Omeje.
Thank you so much, everyone. And please remember to use the information you've gotten here to engage better and ask better questions.